Time is 9:32 and a heads up now for parents. Doctors say this is peak season for a common and highly contagious virus in young children. Hand, foot, and mouth disease is named after the red blistering rash it leaves behind. Fox Medical Team's Beth Galvin is here now with what parents need to know about it. Beth, good morning.
And good morning, Elise.
So is this primarily a childhood illness, would you
say? Yes, I would
Okay.
say it's primarily a childhood illness. We see it a lot in children who are infants or under the age of 5, but grown-ups can also catch it too. And 5 members of the West Virginia University football team recently contracted a strain of the virus, forcing the team to postpone its annual fan day. 2 Major League Baseball players in New York also got sick from a strain of the virus. The good news, though, is that usually hand, foot, and mouth disease is mild. The bad, it's a virus. It's caused by a virus, so your little one will have to ride it out.
It's that time of year here in the emergency departments of Children's Healthcare of Atlanta. Dr. Lauren Middlebrook says they're seeing a jump in infants and young children coming in with fever, sore throat, and a blistery red rash on their palms and soles and inside their mouths. They call this hand, foot, and mouth disease.
So what people may notice is maybe 2 days before they see this characteristic rash, their child may feel a little bit weaker than normal, may not eat as well, may have some fever, runny nose, sore throat.
Most children with hand, foot, and mouth don't need to come to the emergency department and will get better in 7 to 10 days. But Dr. Middlebrook says hand, foot, and mouth is contagious, so practice a lot of hand washing, wipe down common surfaces, and push plenty of fluids. And since it's caused by a virus, the best treatment is just to treat the symptoms.
So if there's any pain from the lesions popping up, you can give Motrin or Tylenol, and then if there are any itching associated with it, you can also try some Benadryl for that. The second thing I recommend is always teaching your children how to sneeze correctly. So one thing that we say in the pediatric world is cough and sneeze, elbow please. So that means cough or sneeze directly into your elbow.
If your child develops complications like a high fever or back or neck stiffness or a headache, go to the emergency department. But for most youngsters, the best medicine is rest, separation, and time.
But what you want to do is make sure you're cleared to go back to daycare or school by your doctor before you increase risk of transmitting this to other kids.
And in rare cases, hand, foot, and mouth disease can lead to serious complications like a viral meningitis or encephalitis, which is inflammation of the brain. But for most children, you just want to watch out for that fever, sore throat, loss of appetite, lack of energy, and also watch for that telltale rash.
So how long are you contagious?
You're contagious for about a week, and so it's really important when you to really kind of coordinate, as Dr. Middlebrooks was saying, with your pediatrician to make sure that it's fine for your child to go back to daycare or go back to school, and it's not, your child's not still in the contagious state.
Important. Yes, very important for parents to do that. Now, how can you take care of the rash and the blisters, Beth?
So I think it's really about keeping it clean and dry and comfortable. So a really mild soap and water that you could use to kind of pat down the rash, and then just letting it breathe and not covering it up. And you just have to kind of get through it. The fluid in the blisters can spread the virus, so you do have to be careful about handling that, washing your hands, that kind of thing.
Yeah, I mean, obviously we know washing your hands is important, but hearing this story and hearing you talk about this, I mean, you have got to make sure you're doing that the right way.
Yeah.
Hey, happy birthday.
Thank you.
Hope you have a good one today,
Thank
Beth.
you.